This Thursday evening, as we put the focus on COVID, let's take a look at what the numbers really are like now. Is there a reason to worry? This is the JN.1 variant that's led to a spike in COVID cases. In the last 1 week, you will see that the number of cases has increased marginally, in the sense that before this, it was below 100. It was double digits. Now it's gone into triple digits. And largely, the number of cases, and these are daily cases that are being reported, from December 16th at 339, has continuously maintained a similar graph, where today it stands at 358. I know it's a sense of deja vu, and not in a good way, as we talk about overall cases, active cases, etc. The number of deaths, let's look at that. From December 19 to today, in all, there have been 6 deaths that have been reported. And you will largely see that whether it's the cases or deaths, it's largely being reported in the state of Kerala. Most of the cases right now being reported in the southern states, in Karnataka, Tamil Nadu and Kerala. And the reason for Karnataka and Tamil Nadu is, of course, because they border with the state of Kerala. A number of measures that have been now put in place in these states to ensure that this spread doesn't go across India. But are we going to really be looking at a COVID wave? Are we going to be seeing cases surge in the holiday season? It depends also a lot on us and what kind of precautions we take. But no, there's no mandate with regard to masks. There's no restrictions on travel or any of that. Let's in fact focus on what's happening in South. We'll be getting our reporters also with us. Shibimul will be joining us live from Thiruvananthapuram. We have Pramod Madhav live from Chennai and Sagaraj live from Bengaluru to tell you what each state is doing right now to fight this crisis. I want to focus first on the state of Kerala, because here you're seeing the most number of cases, where active cases has reached a number of 2,341. The death toll in Kerala due to COVID the last few days is at 3. What's important also to focus on here, when we look at the state of Kerala and these figures, is that the first case of the JN.1 variant has been reported right here in the state of Kerala. And since then, there has been an increase in cases. The Kerala government has already got a task force working. They've also taken a number of steps to ensure that with regards to isolation and all necessary steps, that's immediately taken. But I want you to listen in to exactly what the Kerala COVID task force has to say about this current COVID surge.
If you look at respiratory illnesses in general, the contribution of COVID is much greater in December compared to November, and that was much greater than in October. Fortunately, most of these people are not requiring hospitalization. That's because most of the COVID cases are now occurring in the people who are traveling. JN.1 is a fast spreading variant. It could go into the next tier of the population, which is the vulnerable age group, which is older people and also people with multiple comorbidities.
Now, there are a couple of things we'd also like to highlight. One is that if you look at the deaths that have been reported in Kerala, is largely with people with comorbidities. This variant per se is not a very severe variant. Plus, of course, most of us are vaccinated. So that also helps in the fight against this current variant. Having said that, it is spreading in Kerala, and so steps are being taken to arrest that spread more than anything else. And what helps on that front? The central government has also in fact sent across advisory to state governments to ramp up testing to ensure that if there are any symptoms, people are aware that COVID is once again spreading, and they immediately report back to the authorities. As we all know and have lived through this nightmare, we know what it really takes to fight COVID at this stage. And the focus right now is on what's playing out in Kerala, because there is no doubt a very worrying and concerning spread that's being reported right now in the state. Now, the Kerala government has reassured that they're taking all necessary steps right now. And I want to bring in Shibi Molo on this broadcast on that. Shibi, good evening. What we're seeing right now in Kerala is concerning, yes, and it's been happening for the last few days, essentially, where cases have been going up in the state. What is the government really doing about it? What are the kind of steps that have been taken? What is the advisory sent out to citizens?
Well, Akshita, right now we are the total number of cases in the state is standing at 2,041. That's the latest numbers that we've got from the Union Health Ministry, because the state in the last few months has not released the COVID data. They were releasing it on a regular basis, but since the last 1 month or so, they have stopped releasing the COVID data, which has again raised a lot of questions to the state government. Now, Health Minister Veena George is saying is that there's nothing to panic as of now. Everything is under control. In November, there was an increase in the number of fever cases, and the deaths that were reported in the state were not exactly due to COVID, but all of them who were admitted to the hospital had other serious health issues, and that was the reason, that was the cause of the death, is what Health Minister is saying. She's saying that the JN.1 variant that was first detected in Kerala was already there in India. She was saying that recently in Singapore airport, around 16 Indians who went to Singapore were tested positive for the JN.1 variant. So it was already there in India, but it was detected in Kerala just because of the good health system that's existing. But yes, there have been no proper guidelines that has been issued yet regarding on behalf of the state government side. Health Minister has said that they've organized a meeting. They've ensured that the oxygen beds and keep account on the serious health, keep account on the elderly who are getting admitted to the hospital with keep account on the elderly who are getting admitted to the hospital with fever cases and other issues. But other than that, we have not yet got a guideline regarding wearing the mask or using sanitizers regularly, as we see in other states, even though the number of cases in the state is at a really high actually.
All right, so it's the highest in Kerala compared to other states, and worrying really that the state government, while yes, they've issued several press communiques about what's happening, isn't releasing data on a daily basis. And that's an important step that needs to be taken really by authorities. We're seeing that in Tamil Nadu as well, which we'll talk about in just a bit. I want to focus on the state of Karnataka. Very promptly, Karnataka put in a slew of measures, especially in districts that are bordering with Kerala. Active cases in Karnataka stand at 92. There have been 2 deaths reported in Karnataka, very similar to Kerala. I'd again like to add here that the deaths are with people with comorbidities, who are particularly, of course, vulnerable in this situation. The Karnataka government has promised they're taking all necessary steps. They've in fact advised that people with comorbidities must wear masks to protect themselves with the rise of this variant. Let's play out for you some reactions that have come in from the Karnataka government, including the Chief Minister.
Myself, Deputy Chief Minister, Home Minister, Health Minister, Medical Education Minister, and other officers of the Health Department, and also the members of the Technical Advisory Committee. We met today and discussed so many things. We have taken a decision that this disease, we need not be panic. So far, 3 persons have died, not because of COVID alone, There are other ailments are also there.
All the aspects what the Technical Advisory Committee is saying, and what are the latest reports that are coming, because now we're going to ramp up testing. So by Saturday we'll be doing, going to reach almost 5,000 is what our target is by Saturday and Sunday. So then we will also get new information, new feedback, so that has to be discussed, and what protocols we have to follow in the future, and all those things will be, on a regular basis we need to keep updated and take decisions based upon our inputs. As of now, there is no restrictions on movement, on stay, on travel, on functions, programs. No restrictions are there. Like we've already said earlier also, people above 60 should be more cautious, and preferably they should wear masks.
So 2 takeaways from those reactions. One, where the Karnataka Chief Minister says you have to keep in mind that those who have died also were comorbids. And secondly, where the Karnataka Health Minister says that at this point there are no restrictions that have been imposed, merely advisories for citizens to stay safe right now. Sagai Raj is joining us live from Bengaluru with more details on this. Sagai, the cases that we're seeing, are these largely being reported in South Karnataka, in districts bordering Kerala? Because we know that that's where the government really is putting their focus.
Yes, government is putting a focus on the border, but the cases are more in Bengaluru, because the more you do the test, the more infection you can detect. That's what the experts have to say. And that is one of the reasons why the Karnataka government is going to increase the test starting from today to 5,000. So every day they have to do 5,000 test. And if you notice that what we get to learn according to the data that we have collected from the health department is 3 people have died who were infected with COVID. But they are not only infected with COVID, but also a few other comorbidity issues where they might have diabetic or heart issue or some other things. So that's when these people succumb to those kind of infection, not only for COVID. Totally 92 people have been infected with COVID in the state of Karnataka. 72 of them have been advised to take home quarantine, and 20 of them are in the hospital taking treatment, and close to 7 people are in ICU as of now. But all these people have comorbidities. So as of now, the government says need not panic, but you have to wear mask when there are huge gathering and people above 60 years, and also people who have other disease like comorbidity like diabetic patient or a heart patient or cancer or any other patient to wear mask in public places.
All right, Sagai getting us all of the details of what the Karnataka government is doing. They have very proactively in the last few days issued constant advisories, taken several steps to ensure that they're fully prepared if there is a further surge in COVID cases in Karnataka. Let's focus on Tamil Nadu. There will be questions about what really the government is doing. Active cases right now in the state of Tamil Nadu stand at 89. Fortunately, 0 deaths that have been reported in the state. That number of 89, rather concerning. What you will see is that testing numbers are also rather low, and that's why perhaps you're not seeing a massive surge. But this is concerning that, you've got Tamil Nadu, which neighbors Kerala, and yet not many steps taken by the government so far. Pramod Madhav is joining us with more on that. Pramod, am I right in saying that the government doesn't seem to have woken up yet to the concern of COVID and perhaps the possibility of a surge?
Well, Akshita, one thing we have to also give in consideration is that the state government is battling not just one but 2 disasters. One that occurred in the northern parts, that is Chennai, Kanchipuram, Chengalpattu and Tiruvallur, and simultaneously just a week's time period and a massive disaster has occurred in the southern districts, Thoothukudi, Kanyakumari, Tenkasi and Tirunelveli. And as we speak, even the chief ministers over there, in the southern districts alone, 40 lakh people have been devastated, and there are still areas where the government machinery is not able to reach so far, and it seems like the entire energy is focused on that one. Generally what happens is that if there is a surge in such numbers, the districts that is bordering Karnataka and Tamil Nadu, Karnataka and the Kerala will be given advisories and precautionary methods will be taken. But right now it seems that the entire machinery is concentrating on the south districts, and perhaps in 1 or 2 days the Tamil Nadu government can issue advisories. However, in the beginning of this month we saw that there was a surge in flu alone in Coimbatore, and there was also a kind of information given that senior citizens and anyone with comorbid conditions should wear masks. But right now the entire machinery of Tamil Nadu government is concentrating on providing rescue, relief and rehabilitation for the people who are affected by the floods in the northern districts and southern districts of Tamil Nadu, Akshita.
So there have been natural calamities, yes, but the concern also will be whether that sets up the ground for a further spread of infections like COVID as well as other health issues. The government will be in all likelihood releasing an advisory very, very soon. Cases going up in Tamil Nadu. So hopefully steps will be taken on that front. Thanks very much, Pramod. Thanks, Sagai and Shribi, for joining us with those updates. I want to cut across to breaking news coming in on what the central government has to say about this COVID surge. So here's what top government sources have to say about the rise in COVID cases, particularly in the southern states. They are saying that you must be prepared for a further rise in COVID cases, particularly the winters. During the pandemic, we saw that kind of a trend as well, that during the winters you'd see cases going up. But also what the government has highlighted is that at this point there's no advisory yet on increasing your vaccine doses or any restrictions on travel, or for that matter compulsory masking. Now they've also made it clear that the virus's potential to cause severe illness has most definitely gone down. I want to go across to our health editor Sneha Mordani, who was there for an off-camera briefing also from the government. What's the sense you're getting really from the central government, Sneha? Is there a possibility of any sort of advisory being sent out where they're going to put some restrictions in place, where they're going to mandate masking or any of that?
Not just yet at all, not with these numbers, Akshita, given that the government believes that this is expected and this is going to happen every winter. Remember, it's a cyclical disease. Now, what is JN.1? It's literally the subtype of the Pirola variant, which is in fact from the Omicron family, essentially is the grandchild of the Omicron variant. So it's got reduced capacity in terms of causing severe infection. It's got just reduced capacity in terms of causing death. Unlike, remember, the Delta variant, which actually killed just so many healthy Indians in the horrific, terrible second wave of the pandemic. JN.1 has got no potential, is what the government says and believes after the research that's done. And that's the reason why specific questions on masks, even for the vulnerable, is what the government is not advising at that point in time. Wear it if you wish to, but there is no advisory. Third dose, should you take it if you haven't? Take it if you wish to, but there is no advisory. And they're expecting, Akshata, let me tell you, cases to even go up further, because once this alert has been issued, you could imagine what's happening. There is definitely more testing. So it's not like JN.1 has suddenly appeared in the last 2 weeks. It has been there for quite some time now, but there is more testing now. So when you look for it harder, you'll find more cases. It's as simple as that. Expect cases to increase because there will be more testing. The advice is that do test, but the advice for you and me really is that if you are unwell, the better idea would be to stay at home and mask up, I would say, if there are vulnerable individuals around. Vulnerable, in fact, should be extremely cautious. 23 deaths in India, the government says all of them did not actually die of the infection per se, but died because they were highly comorbid.
All right, extremely useful information. Thanks very much, Sneha, for joining us with all of those details. Just to sum up for you, what really has come out so far from the government, and with this surge in COVID cases, is there a reason for you to be worried? What steps do you need to take? I just want to sum it up for you and explain it to you as simply as I can. First of all, is it mandatory to wear masks again? No, but it is very much advisable in crowded places, considering that there are, of course, diseases and COVID infection also in the air. Is there any restriction on travel? If you've got holiday plans in this season, should you go ahead and cancel it? There are no curbs as of now in any states. Even in a state like Kerala, there are no curbs. It's important for us to highlight that. So you don't need to cancel any of your travel plans as of now. Is another COVID wave anticipated? No. But as Sneha also told us, the case count is expected to go up. And that's largely because you're going to see testing being ramped up. There's no reason to be concerned by any of the data that comes in that shows, a huge surge in your state. Is the current COVID variant of JN.1 lethal? No. But as far as those with comorbidities are concerned, they must be careful, which is always the case. And even during the pandemic, of course, comorbid patients had to be doubly careful than the rest of us. Is the vaccine effective against this new variant, against the JN.1 variant? Yes, very much so. The government, however, hasn't come out with any advisory per se or any directive for an additional dose. So if you're vaccinated at this point, the guarantee is that it won't turn into a serious illness. That much is for sure. And there's no need for you to rush to a hospital and get an additional dose. You could choose to do it, but there's no advisory that's come in from the government.